Greetings, everyone, and thank you so much for joining us for what promises to be an interesting and very informative panel. My name is Professor Jarpa Dawuni. I'm an Associate Professor of Political Science at Howard University and the founding director of the Howard University Center for Women, Gender, and Global Leadership. Welcome to this panel. I would like to first also thank Women Lift for having me to be the moderator for this panel, and to thank you and congratulate you on a wonderful conference on women leaders in global health. This panel is titled Shifting the Power, Reimagining Philanthropy in Pursuit of Global Health Equity. We have an excellent panel of experts, and I would be doing you all a disfavor by not reading their bios, but together they bring over 70 years of experience in the field of philanthropy, healthcare, and global leadership. And you can read more about them on their LinkedIn profiles or other profiles. So I would start first by quickly doing an introduction on the theme. As we all know, philanthropy plays a big role in advancing global health. However, this panel is going to discuss and tackle the pervasive, persistent power imbalances in philanthropy and how such power imbalances can affect the health outcomes we all wish to see. It is clear that these disparities exist in gendered forms and also sometimes in race forms. And so the data show very clearly that the share of funding that goes to women's organizations dealing with healthcare in 2020 was less than 2%. 2% of philanthropic giving went to women's organizations in 2020. The data also show that in the United States, less than 1%, specifically 0.5% of the 66.9 billion given by foundations go to organizations that deal with women and girls of color, so less than 1%. And at a global level, the data do show that local and national NGOs received less than 1%, specifically 0.4% of all the philanthropic giving that went to international humanitarian assistance in 2018. So as you can see, these data point clearly to the problem when it comes to philanthropic giving and how much of that money actually goes to the people who need it. In most cases, women, people of color, and people who live in marginalized communities. So our panelists here are going to tackle these issues, and they are going to help us understand and unpack some of these traditional, existing, and persistent problems and provide us with practical solutions on what can be done. So I'll start off by introducing one of our speakers who couldn't join us, unfortunately, today due to technical problems that she's having. She just might join us, but for now, I would like to say that someone who should have been on this panel, and we hope she can join us, is Dr. Stella Warimo Bosiro, who is a co-executive director of the East African Sexual Health and Rights Initiative in Nairobi, Kenya. I'm also excited to welcome to the panel Yasmin Madan, who is a director of programs at Co-Impact, specifically focusing on gender and other portfolios, I think. And also Sarah Hendry, the executive director of the Global Center for Gender Equality at Stanford University. And last but not the least, Dr. Nachiket Moore, visiting scientist at the Banyan Academy of Leadership in Mental Health. So welcome all of you to this panel, and I look forward to hearing your wonderful submissions. I'll go straight to the first question, which would be directed in this case to Ms. Madan. Ms. Madan, why is funding that supports leadership in low and middle income countries, particularly initiatives led by women, important for gender equity? Can you share an example of a time in your long career where, particularly with local organizations, where you saw the importance of this firsthand? Thank you.
Thank you, Jarpa. And first, just such a pleasure to be on this panel with everyone. And again, thank you to Women Left Global for hosting us. I think the numbers you shared are quite stark, and I really hope they do give us a pause. So to answer your question, I think let's start with a simple concept: nothing for us without us, right? And if we think about this basic principle, then programs for women and girls should be led by women. But as you shared in terms of funding, the overall picture is also quite skewed. Whether we look at heads of organizations, powerful entities, representation in senior government institutions, COVID recovery committees that we've seen recently, women are just significantly underrepresented in leadership positions, and they're seen as recipients rather than drivers of change, right? And so women are being systematically held back on one hand. On the other hand, we have so much evidence to show the impact that women's rights organizations, feminist movements have had on changing the status quo, in bringing about catalytic change, making government systems more accountable, harnessing power of collective leadership, and I can go on. And yet your numbers showed they're significantly underfunded. And this underrepresentation of women's leadership also has consequences in that it creates inequitable outcomes. First, you're just not tapping into half the talent pool of the world, but you're also missing out on diverse perspectives, lived experiences, different viewpoints, different ways of leading that's just not being channeled. And so for women, to benefit and for change to be truly transformative and sustained, we have to shift these cultural norms and narratives around women's roles and women's roles as leaders. And they should be empowered to lead at all levels, right? We sometimes think of leadership just at one level, but it is at the household level, at the community level, in organizations, in the highest national institutions. And, to share an example that you asked for, when we were setting up the Gender Fund, we did consultations with over 80 feminists, activists, advisors, advocates, social change leaders, gender experts, representatives from women's communities and movements. And what we heard consistently is, despite the evidence of the transformative change that can be brought about by women-led, women rights organizations, they're underfunded, undersupported, as you shared. We also heard that what they actually need is long-term flexible funding, and not just funding for the programming, but truly funding for the organizations. And that we heard, trust the locally rooted organizations to best know their context. The solutions can only come from there. And frankly, this is not how philanthropy is working today. So what we've tried to do is take all of this and really designed our latest open call for the Gender Fund to reflect some of this. I'll pause there and hand back and want to hear from the other panelists.
Thank you very much, Ms. Madan. That's very important. Listen to the people who need the help. Thank you so much. So I turn over now to Ms. Henry. Ms. Henry, the Global Center for Gender Equality aims to challenge the status quo of philanthropy, including by supporting philanthropists to incorporate an intersectional gender lens. In your work to advance gender justice in philanthropy, what have been among the hardest practices to change? Thank you.
Thank you. And I really appreciated this question. And I also, Yasmin, I really appreciated your earlier response as well, because I think both with the dire kind of statistics that you shared to begin with, but really getting to this idea of there's a lot of the practices, there's a lot of intention, a lot of words around intersectionality and feminism and movements, but not a lot of action. And people are getting stuck at different places. But a lot of that too being around, and also something, Yasmin, that you said that really resonated with me, is it's by design. The systems of philanthropy are not designed to be able to reach the communities. We have very biased, historically colonial, patriarchal systems, and they're not designed to actually reach these movements, even when we have substantive evidence that shows that by investing in community-led, in feminist movements on the ground, in locally led solutions, the money's still not getting there. And I think to be tactically too, the way that we've designed philanthropy too is to be very topic specific, right? So we are taking it topic specific really, and we need to move away from this kind of, and particularly around women, it's a very instrumentalist approach, right? And getting away from kind of women's health as a vehicle for child's health, women's health as a vehicle for community health. And how do we actually see it as an end in of itself, as you've mentioned in the kind of in the statistics, but that being the reason. And also too, the kind of way in which we've also positioned a lot of women in global health as community leaders, which is fantastic, and they should be, as you said, but also often unpaid, often voluntary on a full plate in the additional, 10 hours of a day on top of things. So how do we also position it differently and start to value, change the value systems, as you also said, Yasmin, the underlying norms. And also in terms of some of the barriers too, is we also see a lot of relying on known entities. Again, the bar gets really high in this, as you also, you mentioned earlier, Dr. Dawuni, this idea too of when you actually look at women of color-led organizations, that number gets to below 1%. And it gets down to also to these issues of relying on who we know, actually the biases that come into what we do, and down to this idea of trust. And how do we start to really reframe the system levels of philanthropy to think about and actually design things to be intersectional and feminist by design, instead of trying to retroactively. I think one of our biggest challenges, we've done so much time trying to retroactively design something that wasn't fit to do that. Or asking of a massive big program, what was the impact on women's empowerment or women's leadership after what it wasn't designed to do so. And so I think there's just also a real big opportunity, as you were saying too, Yasmin, on the systems level. How do we really think about what are those levers for change and design it differently to actually address the barriers that we know exist? And I will leave it there too, because I'm excited to hear from others.
Thank you very much, Ms. Henry. That's really important. And I'm glad you built so well on Yasmin's experiences and really what they have done, listening to the people who are going to be receiving this, the end users, to redesign or even design this gender fund. So really good segue. Thank you. So Dr. Moore, I turn over to you now. As the former country director for the Bill, so India country director for the Bill and Melinda Gates Foundation, you worked closely with all sectors, including the government, local, global nonprofits, community groups, researchers, and the private sector, just to name a few, to advance India's health and development goals. Can you share an example of your work with a partner where you felt their local experience or approach was uniquely valuable or effective in advancing equity? Thank you.
Thank you very much, Dr. Dawuni, for inviting me to speak, and to the organizers for giving me the honor of being here to contribute to this important conversation. I want to, build a little bit on what Ms. Madan and Ms. Henry said, and then, specifically answer your question. Clearly, this issue of local organizations, and something that the Gates Foundation has worked on, to a degree in India, is an important one. And Ms. Henry said, giving support to the known organizations. Now, one of the challenges with local organizations is they are new, they don't have the organization structures, there is a higher degree of risk that they may fail, because they're not able to make many of the other pieces work. And that risk-taking capacity, along with the support, financial support, has to go hand in hand, rather than programs that are designed, even perhaps in other developing countries, not necessarily just in universities, and then transported to countries like India. And India, as you know, is really many sub-regions, sub-geographies, fundamentally different from each other. That even taking a program from Bihar to Kerala, you have to think quite carefully, because the contexts actually are fundamentally quite different. So India is well-resourced. So programming design of a type that might be appropriate for some other country or some other location, in which you're directly funding women or maternal child health or specific activities, might be less appropriate for us. Much more this idea of supporting local organizations and really investing in them over 15, 20, 30-year periods, so that they become powerful, strong advocates, researchers, many of these wonderful centers that you all belong to. We need more of them to grow out of the Indian subsoil at the state level, at the local level, so that they can be relevant locally. The other point Ms. Henry made, which I thought was a very important one, this issue of volunteerism. And we have a large field force of health workers that are in a way labeled as volunteers. I worry about that labeling because in some ways it gives you almost the right to say that, well, now they can be asked to do a lot of work without fair pay, without good training, without a good career path. Countries like Thailand have built fabulous health systems by doing the exact opposite. They started with these very women, but then they paid them, they trained them, they gave them career paths, and over a 20-year period, built senior women leaders from these very volunteers that they hired at the local level. So I think that's an issue, particularly in this COVID response. Many of these workers have been celebrated, but not paid. I would much rather not celebrate or celebrate also, but pay because, they have lives to run. And then, there's a clear opportunity there. Now, in terms of examples of what, I don't work for the Gates Foundation anymore, so I don't have the ability to speak for them or on their behalf. I just want the viewers to be clear about that. But some organizations that I do know about that the Gates Foundation funded was one, for example, at Ashoka University, a local university in India, a center called the Center for Social and Behavior Change Communication, set up by Dr. Neela Saldana. It's a locally grounded group. It understands what is happening in the local environment and has become now a partner of the government on issues such as malnutrition, maternal child health, particularly the communication side, bringing the best of understanding of behavioral science with the local understanding of what's going on. And Gates Foundation has given them, along with other partners, extended long-term support, exactly of the type that I think is appropriate and that is needed. There are many other examples that I could give, but let me just stop here and so that we can move on to explore other aspects of this issue. Thank you.
Thank you very much, Dr. Moore, and thank you so much for bringing us to this idea of, once again, local knowledge, supporting local systems, organizations long-term, and really believing that they can build and get better as they move along. Thank you. So we've heard from the experiences of our panelists based on their work in this field and also personal experiences. And so now we're going to shift the discussion a little bit, looking more in terms of how we can move the needle, how we can transform philanthropy. So as we know, once again, philanthropic organizations are often based in the global, what we will call, conceptualized as the global south. They are mostly led by men, and they are mostly led by white men. And so that means that as we whittle through these intersectional identities, the number of women, the number of minority women, and the number of women who are considered to be marginalized dwindle and almost non-existent. So that means that there must be a systemic approach to addressing the issue, going back to Ms. Henry's point about redesigning leadership roles, redesigning philanthropic organizations and the ways in which they interact. So I'm going to start off in the opposite direction from where we came from. In this case, we ended up with Dr. Moore, and I'm going to take you as the next person and then build my way back up to the rest of the panelists. So Dr. Moore, what can leaders, or male leaders in particular, do to better empower women and individuals from marginalized groups to have a bigger voice and more decision-making authority in grant-making decisions within philanthropic organizations? So we're talking about male allies, transformation, and giving voice and agency. Thank you.
I think these are very important questions, and I will quickly go over two perspectives. One is internal to philanthropic organizations, and one is in the larger community of marginalized women and marginalized communities. How can both these sets of people have voices? Inside the organizations, and I've had some experience with Gates. I was the board chair of Care India for many years. and of a number of local philanthropies. I've seen two issues where I think male leaders can play a big role. One, it's not as if powerful women do not exist in these organizations. They do, and they have voices. Sometimes there is a concern that I've observed that a powerful voice coming from a woman can be seen as overly aggressive, can be seen as, oh, no, this person needs to, be somewhat more quiet. Now, allowing them the space that their voice, which they don't need support for, they have a good voice and they have useful things to say, but preventing that from being silenced. The other, and again, this is something that I think is important, is there is a group of mostly women, men as well, of introverted people. They don't speak up as quickly. They need space, they need time. But in any meeting, particularly in some of these, very active, fast-moving organizations, there isn't that much time, there isn't that much space. People are always cutting each other off and speaking about things, pausing the conversation, requesting the more vocal, often male members to be quiet for a while, so that people who don't naturally cut other people off have an opportunity to speak. I think is really, both these, I think, are quite important steps inside organizations. On the outside, I certainly, the idea that, if you're going to talk about issues relating to a particular community, they must directly be a part of that discussion and not simply by proxy. I think that's an important piece. But I think it's also important, and I don't often see this, to do careful work, particularly qualitative research, with multiple marginalized groups, so that their voices, their ideas can be heard and incorporated in a high quality, in-depth manner in any decision making that's going on. Just having a representative from that group present may not be enough, because somebody may have a perspective that they are not comfortable saying publicly. They may be illiterate, they may be poor, they may be sitting in a village, not able to travel to Delhi, and not comfortable in a fancy glass office, saying something. And sometimes I worry that representation can sometimes become tokenism. You bring, and I've seen somewhat, cringe moments of these very uncomfortable women being paraded out. They say something, we all applaud and then they leave. But then the conversation goes right back to what it was, as if they were not there at all. So I would say these are two sets of ideas that could be useful to explore further.
Thank you, Dr. Moore. That's really wonderful, breaking it, looking at it from within the institutions, organizations, and also outside. And I know that there's a lot more you could tell us if we had time, but I really hope that we can continue this conversation with you in the networking room and other spaces when this panel is over. And of course, we'll continue to engage with you. Thank you. So you have talked about how men can be allies, or male leaders can be part of the solution finding processes that we are going through. And this is what really this conference is about, women leaders. And I'm glad you said women have the voice, they have the agency. And so let's respect it. So for that reason, talking about changing systems, Ms. Henry, I turn over to you. And you talked about this idea of redesign earlier on in your discussion. So what are some of the biggest barriers in the philanthropic sector to redesigning or designing and targeting more equitable and effective grants that possibly impact communities, women, and marginalized groups, right? So what are some of the biggest barriers in making these transformations? Thank you.
Thank you. Thank you very much. And also just reflecting to Dr. Moore on one of your comments as well, when we talk about the systemic level, and I think particularly around women leaders. We often create programs to empower women in a vacuum without looking at a systemic view. And I often think about this too, is right, we continue to put women in situations, as you were saying too, where they in a position where they have to interrupt because we're not getting at that systemic level. And as you said, the kind of level of tokenism, right? And instead of having them creating a system and an environment that allows them to thrive, we put them in a system to actually survive in that. And I think that also gets to the, as you were saying, Dr. Dawuni, on the barriers. And I think, what we found really too is, and I mentioned earlier, that the system of philanthropy wasn't designed to really build or disperse money in deeply intersectional, feminist, equitable ways. And I think a lot of those barriers come from the system that we've designed, which is very hierarchical, and the power imbalances are incredible, and position it in a way in which it's very hard to take that system and be able to do that. And so the particular barriers, there's a big lack of transparency. You oftentimes grantees and women's groups are putting in applications. There's thousands of applications. They're using their unpaid time and labor to be able to put it into a system. And there's no transparency into how individuals were chosen, how that is being dispersed, or vis-a-vis these other organizations. I think also get also to that level of accountability. This system is built to be funder-centric. Funders are deciding what the most important issue is, and as been mentioned by other panelists, often in isolation, not in community, not with, but definitely in many instances. And speaking from a place of working in a university in an ivory tower, developing something and then coming out, and not necessarily being driven. And so how we can shift the system to where the accountability is actually funders are accountable to the social justice movements or the feminist movements, and hopefully that we're moving forward, I think is a really exciting opportunity too within philanthropy. And also this kind of idea of, and you were saying too, we have tons of evidence. And I think one of the barriers that we continue to have is that, it just drives me nuts. It's like constantly being asked to build a business case. And the bar for particularly of giving to grassroots movements, feminist movements, particularly of women of color, is the bar keeps getting higher for building the business case. And I think Dr. Moore also brought this up too, is this idea of risk. And it all comes back to, I believe, to this, what we value, what we deem risky. And I think that there's a lot that we can unpack there around how we define risk, how we really think about these systems and again, back to this design and intentionality, because we continue to put things down a system and a pipe and expect different results. And instead of really looking at the systems level. And I think there's some really interesting ways that we can address these barriers through that intentionality and design.
Thank you so much, Ms. Henry. I really like that emphasis on intentionality and design. And I'm also very happy to hear what you mentioned about the business case. As we know, the data do show that women build businesses at a faster rate. We've seen a lot of that during this COVID-19. And in the particular case of the United States, we see that Black women are more likely to create new businesses than any other group. So when we're talking about a business case, women do it, but it's just a matter of, will that business case fit into the already designed model of what a business should look like? So really important what you're saying about redesign. Thank you very much. So I'll turn over now to Ms. Madan. And what do more equitable partnerships between donors and grantees look like? How can they be reimagined to better address the needs of women and other marginalized populations?
Thanks, Jarpa. I'll use the framework we just got from Sarah, right? Intentionality and design. So let's start with intentionality. When you call someone a grantee, it's a passive recipient, you make it sound like. Whereas as funders, we have the privilege of directing our resources into the vision and mission of social change leaders and their entire organization. So to start with, for instance, at Co-Impact, we say program partners. It's an equal partnership, right? Then I'll talk in terms of what, who, and how in terms of the design. So So funders have outcomes. We are interested in advancing gender equitable outcomes in health, education, economic opportunity. But what that looks like in the context, we don't know. So a certain organization may focus on gender-based violence. We have that in Brazil, where there's 27% prevalence. Another organization in India is working on maternal mortality that unfortunately is still around, right? Despite all the progress we've made scientifically. Somebody else may work on sexual and reproductive rights. And for some other organization, it's about transforming the agricultural sector so that it finally works for smallholder farmers, right? And so we don't say, this is my strategy, come and implement, but we say, these are the outcomes, this is the impact we both want to see in the world. So tell us, because you're committed to the cause and the context, what matters, right? So that's how the what happens. The who, I honestly think we have to acknowledge as funders that the biggest and perhaps the only limitation to funding women-led, locally rooted organizations is our own perception of risk. It's our mental models. The evidence is there in the capacity. So this funding round, Co-Impact has said 100% of the country level grants will be global South locally rooted organizations. At least 75% will be women-led organizations. Last funding round, we said 100% global South, 50% women-led. It was so easy to meet that. We had more than enough applications and we have some stellar initiatives. So it's not like the capacity doesn't exist. It's not like the organizations aren't there. It's not like the evidence doesn't show they can have impact. We just had to say it in our open call. And so the who matters, right? And then the how matters as much. We fund for programs and plans. We should be funding for purpose and people. So let's actually fund for what the organization does and fund the organization itself. I think the biggest contribution philanthropy can make is not just get outcomes, but actually build resilient organizations that are locally rooted. And so, and put them in the driver's seat. Like I said, let them determine what it is. Center equity in our approaches. And finally, I want to say, unless the backbone across is women's leadership, this isn't going to work. It's not like it can be women's leadership at the outcome level, but not in the organization level, but not in the funding level. It has to be the backbone, because that's not the case today, right? It's not 50% leadership. So we kind of need this gradient of equity to finally arrive at equality.
Wonderful. I love that. So many tweetable terms in all your submissions. You know, say here's something new: fund for purpose and people, and just great, really conversations. And I really admire and I must commend what Co-Impact is doing. Really, what Sarah Henry has talked about, trying to redesign the models, existing models, involve the people on the ground, like Dr. Moore mentioned, and make sure that they are part of the decision-making processes and what the outcomes are that we all collectively want. Really impressive discussions from all of you. Thank you. So we're rounding up now, almost to the end of our wonderful panel, and I wish we could stay here longer, but I know that other panels will be happening, so we cannot stay here forever. I think we have a few minutes before I come down to each one of you for your closing remarks for our audience. I would like to throw in a question which really should have been answered by our other panelist, Dr. Bosire, who couldn't join us due to technical problems. And the question really, and I think you've all addressed it in different ways, but given that she works on sexual minorities and sex worker human rights issues, I'm going to flip it, not necessarily on those specific issues of sex worker human rights and sexual minorities or gender minorities, but broadly within the scope that you all work on. And the question is, how could you share with us, or can you share with us, some examples of participatory grant-making models and how such participatory grant-making models can help us advance diversity, equity, and inclusion in philanthropy? I know you've all talked about it in different ways, but I want to throw it now within the larger context of what we're all talking about now, DEI, diversity, equity, and inclusion. So how can we make it really participatory? Thank you. I'll start off in this case with Dr. Moore again, since we flipped the ground, so we come back to you first.
Well, thank you very much. Again, perhaps the other panelists will have more insight to offer in this area, but certainly at the Gates Foundation, we've run for a long time a program with the Department of Biotechnology and BIRAC. It's a science-based effort. It's kind of a grand challenges effort, but aimed at local investors, local innovators, and it's a joint effort between local innovators and the government, as well as other philanthropists, to try and encourage newer ideas and newer projects to go forward. And there's an active effort on the ground to find these innovators, because sometimes, as Ms. Henry said, people spend a lot of time applying and then they don't know what happened. Whereas, so there is a need for encouragement. There is a need to find people that are doing interesting work. So that's been a long-standing effort of the Gates Foundation, and I must say, it has had a fairly strong impact in terms of seeding a number of new ideas, several of them women-led organizations that have moved forward. So that's the one example that I'm happy to share here.
Thank you very much. I'll go next to Ms. Henry.
Yeah, thank you. I really appreciated what you spoke about, Dr. Moore. And I think, I think where I've seen really incredible examples is, again, in that intentionality of design and actually seeding power from the very beginning in an intentional way. And I've seen it done very creatively. And what historically too is we often bring on advisors or strategic advisors to oversee a grant process, usually women of color who are already running incredible organizations. It's usually unpaid in their extra spare time. And so models that I've seen be really incredible is actually valuing people's time and expertise. And so funders actually pay. It's back to Dr. Moore's point too, getting away from this kind of tokenism or showing, look at our advisors and say, these are paid experts with deep expertise, and we're going to pay them to be a part of this process. And also very, very transparent also on the grantee side, where you're actually supporting that planning grant. You're not extracting ideas in a competition. You are actually supporting incredibly thoughtful and experienced leaders on the ground to further develop their ideas. And as Dr. Moore said too, paying to give them that technical support and wrap your arms around them, instead of this almost like the Shark Tank we've created within development, right? Where my survival depends on somebody else's not getting it. And how do we actually build as funders, seeing themselves as funders and in that as part of the social movement, having a key role in it, but the role being seeding power and challenging the status quo for what is a leader, who is an expert, and how we use data and evidence to build the case, because we don't have time. We are at the precipice of a moment where there's a massive opportunity to shift this. And we have this opportunity. So I really appreciate this question, because the models are out there. But it requires a different mentality. It requires shifting our frame and our paradigm to actually get at these root causes of injustice.
Thank you very much, Ms. Henry. That's great. Ms. Madan, over to you.
Well, I mean, participatory grant making is a spectrum, right? And I think we can also look at our spectrum of everything from sourcing to reviewing and diligence to actually program support and see progress we can make. So I'll take one part, reviewing, right? Historically, we used to rely on experts to review. Were you an expert in health? Were you an expert in education? We've now changed. So this open call that we have, we are recruiting external reviewers who are based in the context. We're accepting concept notes in at least 6 languages. And we are allowing for that process to happen, right? So there's language justice as well as context that's being prioritized in the review. So that's a start. The second example I'll take is, often funders say, okay, great, I've got this plan, I want the outcomes, let's get started. What we actually do is we then say, after all that selection process, all the review, we then say, okay, here's $500,000. Now take about 6 to 8 months to go back to the problem analysis, to go back to your outcomes, to go back to your partnerships and coalitions, and really think about what you want, because you just haven't had the luxury of this time and space. So call it year 0, call it design phase, call it, but we actually give $500,000 for them to then develop a strategy, not for us, but a strategy that needs to be resourced, right? So instead of writing a proposal for a funder, it's a strategy that needs to be resourced that we can all buy into. So just 2 quick examples of how we're thinking about it. But I have to say, this is one of those things like a muscle. You have to keep training it, and the weights have to keep getting heavier.
Thank you very much. That's really true. We just have to keep training it. And like, you know, we've heard from Sarah that it needs redesign. And we also have to remember that we are not in a static world. So it's the world is dynamic, the systems are dynamic. And so as they move, we have to retrain it with different weight sizes, like Yasmin has said. Really, this has been a great conversation. I have learned so much personally, and I'm sure our audience have also learned a lot. This is just the beginning of a conversation, many more to come. And I really thank Women Live for putting together this conference about women in leadership, or women in in healthcare, leaders in healthcare. And I think that there'll be many more discussions happening the rest of the day. And I invite everyone who has listened to us, please check out our panelists. If they do have social media, that means that they are, you can follow them, and also check them out on LinkedIn. If they don't have social media, then please don't create one in their name. But I'm sure that they would love to follow you. They would love for you to follow them, engage with them if they are available to be engaged. And I personally thank you all so much. I thank Women Lift and for making this conference open and available. I would please like to advise, or kindly maybe make an announcement rather than an advice, that for all attendees who have joined us today, could you please navigate back to the agenda page where you will have an opportunity to RSVP for the networking rooms. And there you will also have the chance to meet other attendees and discuss sessions from today, and of course, keep the discussion going. So before I hand over to the organizers, Dr. Moore, you're unmuted. I'm not sure if you want to come in with a quick word, or that was just, do you want to say something?
No, I was just going to say thank you very much for having me here. It was a wonderful discussion, and I hope to continue the conversation.
Okay, thank you too. And thank you once again to my wonderful panelists. It's great. I am personally reinvigorated. I'm sure Women Lift has also learned so much for their work going forward. And thank you, Sarah Henry, for your time. We wish you the best as you are giving the best advice. And of course, Yasmin at Madan, Madan at Core Impact. I know that you will continue to do the good work and retraining that muscle, or the many muscles, for gender equity. And Dr. Moore, we wish you the very best in your visiting position. And thank you for all the great work you have done with the Gates Foundation, and you will continue to do for humanity, and I like to say womanity. And so thank you all so much. Have a wonderful rest of your day. Enjoy the rest of the conference, and we will see you some other time soon. Thank you.